Health. Yours truly, Dr. Jason Batson from Batson and Associates. And of course, we have something a little special this afternoon for you guys. I have two guests with me. I have actually Mr. Paul Green, who's one of the senior consultants and blood microscopists at Batson and Associates. And I also have a special guest, additionally, Ms. Shakila Daniel. Ms. Daniel, good afternoon. How are you?
Good afternoon. Thanks, Dr. Batson, for having me. Good afternoon to all our listeners.
Yes, and of course, the reason why we have Ms. Daniel here this afternoon is to really launch the new aspect of weight loss that we'll be doing with classy bodies in association with Batson and Associates, because we know weight loss, is a critical issue that affects a number of persons in Trinidad and Tobago. As regards to our numbers, we have a high adolescent obesity rate as well as a very high adolescent diabetic rate. And what we actually pioneering here is something that's going to assist those key aspects, those components of society, as well as persons who are looking at weight, because visceral fat plays a significant role in inflammatory damage in the body and that type of thing. So I'll allow Ms. Danielle to of course introduce herself and that concept, and of course we'll continue as we go along.
All right. Yes, a lot of excitement. I'm really happy to be here. Can you guys hear me well?
Yeah, we hear you loud and clear.
Okay, lovely. And yes, Dr. Batson, as you mentioned, obesity continues to be something that I think worldwide is a problem.
Yes.
Persons are always interested in losing weight. And we have both men and women having this issue.
Definitely.
A lot of women, weight gain is a byproduct of things like hormonal imbalance, PCOS, just getting older.
Yes.
Sometimes when you hit 30, the amount of food we used to eat and burn off is not the same.
Correct.
And we also have men having that visceral fat issue, the stomach,
yes,
that belly just rise.
Yes.
And a lot of the hard, stubborn fat in the abdomen area, the abdominal area, is a problem for a lot of persons. And we have seen, as I'm sure you'd agree, that obesity increases persons' chances of suffering with diabetes,
yes,
hypertension, all non-communicable diseases.
Definitely.
Because your organs just can't make
can't function properly.
function properly, because it planned to hold you at about a 150.
Right.
If you operate at 250, it's 100 pounds more.
Exactly. On the musculoskeletal system, affecting those type of things. So tell me something, Shakila, what makes this weight loss aspect different, and what makes it effective as regards to what persons actually would be looking for?
All right, so our Classy Bodies Wellness, which is my clinic, Classy Bodies Wellness is one of the only medical nutrition clinics in the region, right?
Yes.
And what makes us different is that we have a medical, clinical, and scientific approach to weight loss. It's not your lose weight now, ask me how kind of.
Yeah, exactly.
This is a lot of testing, a lot of discussions. We do a lot of we do blood works, we do anthropometrics, meaning we take in your weight, your height, your visceral fat, your muscle percentage, your bone density. We let your body tell us a story of what it has been through, and then we work with you, right? Now, this particular program that we've partnered on with, it is really unique because it reintroduces a hormonal chemical, a natural chemical, a natural digestive hormone that exists in our stomachs already.
Right.
But as we age, we decrease the amount that we naturally produce.
Right.
Yes. And so that digestive hormone is responsible for telling us we're full, saying stop it, relax. Right? But the more we are accustomed eating and we increase our portion sizes, our stomachs adjust.
Exactly.
To not say
that we full. Exactly.
The introduction of this chemical lets you get back that function to be like, okay, one spoon of rice is more than enough.
Right. And let me just interrupt you 1 second here. In terms of the dynamics of that, one of the things I just want to highlight here, how you uh, mentioned exclusively as regards to the medical clinical the testing aspect. That's a very important aspect to that, because I always tell persons you could only manage what you measure, and especially in the aspect of weight loss, especially in the aspect associated, because I understand in terms of the way the program has been structured, it takes a number of diseases into considerations: hypertension, diabetes, that type of thing. You highlighted visceral fat, which we know is that organ fat that literally produces inflammatory chemicals in the night while you sleep. So I tell persons the higher your percentage of visceral fat, the greater your likelihood of developing things like, as you mentioned, diabetes, but especially cancer, even colon cancer, colorectal cancer, even the aspect associated with women where they have that large amount of weight in the midsection there. And then that, of course, triggers things like polycystic ovarian syndrome, serious endocrine problems that in turn give you hormonal imbalance. So, that is one of the things I want the listeners of 106.5 to really get, that, it is a medical approach. It is an approach where you have empirical data, where you could actually track the data, and you could actually, with the aspect associated with diabetes, because at Batson Associates, we run an integrative diabetes center. And I've been working in that center essentially over 14 years now. And I always tell persons, when you have the ability to help a diabetic patient to not only lose weight, but also to maintain or attain better hormonal levels, especially as it relates to insulin, then you give them a certain level of control that they didn't have before. And that is what we're going to actually be seeing with this particular weight loss protocol. And that is something that I really wanted to pinpoint exactly, in that particular case, especially as it relates to diabetics, because the numbers saying that 1/3 of our population is diabetic. So we're speaking about over 450, 500,000 people, and a lot of these persons are adolescents, 14, 16. I mean, our youngest diabetic client that we have is 5 years, and that client came to us at
Type 2 diabetes?
type 1 diabetes, actually. Came heavily on diabetes, not diabetes, sorry, on insulin. And when we did the protocol, we adjusted the diet and that type of thing, we were actually able to get the clinic to get them off of the insulin. And that in itself really showed. And what we did is, really worked on, I did a miniature version of what we're going to do on a grander scale, because this was a child, didn't have any issue with obesity, but in terms of the digestion and the body's inability to break down sugar, that is what we work on. And this program is basically an extension of that. So what I really want us to do, Ms. Danielle, is really give the information as regards to where persons can contact, get in touch, and actually get to start this particular program that really assists in all these aspects that really affecting both male and female, young and old, because it's not only persons in the 60s, 70s that have diabetes, 50s. We have persons, as we realize, as I said, 5-year-olds, 10-year-olds, 12-year-olds. And this is something that could really help in that, in that whole aspect there.
Yes, I'm really grateful you mentioned that insulin. Two things you mentioned when you were speaking there that really stood out for me: insulin and stomach and organ fat, right?
Right.
I feel like locally we make it a joke. Oh gosh, that fella have a big belly, yeah, or women want their belly down because they feeling not making them look sexy. They want a flat stomach for aesthetic purposes.
Right.
But with understanding the health issues that
Correct.
a big stomach has, it's more than just you can't fit in your jeans,
Exactly, precisely.
It's you are heading to developing, as you would have broken down scientifically, the implications of that, because all that visceral fat is a high estrogen producing
correct
substance. What really fat is stored energy.
Correct.
So you have consumed so much energy at your body waiting to keep in reserve.
Yes.
And you have it there.
Yes.
All that reserved energy stored, it is just producing estrogen, and you know who love estrogen?
Exactly. Cancer. Cancer.
Yes.
Mm-hmm.
You know, so, persons, we want to have the correlation and understand what you're really eating yourself into.
True.
And insulin, Jason, what is insulin? I don't want to put you on the spot, but this is something I think you and I know what we take for granted.
Exactly. It's the hormone that's primarily produced in the body, and its purpose is for basically insulin, glucose metabolism in the body.
The average person does not recognize insulin as a hormone,
I know.
It,
I'm quite aware of that. Yeah.
including diabetics. And
Correct.
so there we are with the issue. And so I'm very grateful that you have me here on this program to really promote and encourage education. Diabetes, you shouldn't have a disease.
Mm-hmm.
You don't know what is
Exactly.
the hormone
Mm-hmm.
that you need to help regulate it. And so this program we're doing together, it is that hormone. I don't know if they mentioned the hormone is semaglutide. I know it's a very, weird name to remember, but it is also a hormone to help with digestion.
Yes.
Really, really hoping that persons could join this program and see its amazing scientific results to assist, especially diabetics, because this medication is primarily designed, it was initially designed for diabetics.
Correct. Right.
But because its weight loss capabilities are so high, we are introducing it now as a part of our weight loss protocol that you can, even if you're not diabetic, you could benefit from.
Definitely. And let me just add there too as well, with that whole aspect, with Batson and Associates, we also took into consideration a number of holistic aspects associated with weight loss. For example, dealing with buildup of toxins in the liver, which play a significant role in metabolism. That's the largest internal organ. It has some of the most functions associated with metabolism as well as energy. So, we're going to also be doing some work on that. So the protocol is one that is quite balanced, it's holistic, and tailored specifically to individuals. So even though you have some general aspects associated with it, based on the blood profiles and all the other diagnostics, you're actually able to tailor a program that is specific as well to a individual. And that, to me as well, is a key thing. Persons, you want to lose weight and look good when you lose weight. You don't want your skin to be saggy, and you don't want your skin, you don't want to have to deal with all that additional nonsense, as it were, if it is you don't do it correctly, putting on an even larger amount of weight subsequent to the weight that you lost, and that up and down. So what I will quickly,
remember we left that word, eh?
yes, love it, integrative. So what I'll do quickly, of course, I will allow our third base to just remind the listeners of the telephone numbers that they could actually call if you have any questions regarding what we're discussing regarding the program. In addition to that, in terms of contact, what I will do, I'll give the numbers for Batson and Associates. Of course, there is a registration aspect associated with this, and we'll speak about that a little as we continue. Those telephone numbers, of course, for the Shipgoner's office, you can give us a call on 222-8261. That's 222-8261. And of course, that WhatsApp number is 314. That's 314-9975. You're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates. And I have my special guest this afternoon, Ms. Shakila Daniel, versed in nutrition, and most important, medical nutrition and dietetics, which is so important from that medical and clinical perspective. And of course, we're discussing weight loss, we're discussing diabetes. Third base, you could just give them that telephone number so that anyone who's interested could give us a call.
And before I take that number, we do have a call on the line. Hello, caller.
Yes, good afternoon, Dr. Batson.
Good afternoon, sir. Good afternoon.
Doc, when I first found out I was diabetic, I had a bigger belly than I have now.
Right.
And I asked the doctor, well, what can I do for myself? I mean, I know there's medication and all that.
Right.
Well, you have to lose the belly, number one.
Mm-hmm.
And the other thing he said was that if you exercise every day, and on some days you exercise vigorously, you will put back the bad effects of all that belly fat. That's a way that you can help yourself.
Right.
With the use of added medication for a treatment of a big belly to thin it down and whatnot. That, and it stuck with me because it is something a person could do for himself. Just exercise a lot,
Uh-huh.
and you put back on the negative effects.
That you would have put. Okay, good. Okay, I respect that, and we'll make mention as we go along. So or address it rather. So let me just quickly say I appreciate and understand what you're saying. But you see, one of the key aspects that happens with a lot of individuals, and I'll give you an example. For example, people who suffer from mental issues. For example, people who suffer from depression, anxiety, insomnia. When these people go to bed, now you want to sleep. You don't want to be depressed. You don't want to get an anxiety attack. You don't want to get a panic attack. Look at women who suffer from postpartum depression. Postpartum depression, a mother no longer has proper reasoning, and she's actually want to harm a child that she would have given birth to. That is not natural. That's not normal. And the reason for that is because of the chemical imbalances in the brain that is caused by significant depression, anxiety, malabsorption, and nutrition, and that type of thing, right? So exercise, a healthy diet would also help that individuals. But in this particular case, as it relates to weight loss as well, there is additional things that the body need because the body is actually imbalanced, you know. And that is one of the things that we actually helping persons to address here, that hormonal imbalance situation. A lot of people do not understand. There are women running around the savannah, and you see them every single day. And you see them for 6 months, and they're the same size. But they're diligent, they're there every day. The problem is not the exercise. The problem is not the diet. The problem is because the body is so imbalanced, especially as it relates to the endocrine system, that the hormones that is supposed to be keeping you nice and trim and fit, because they are out of balance, they now have you obese. So all that exercise you do would not matter until you address those imbalances. So we know exercise is good. We're not saying no, you know. But what we're saying, these people need additional help to get out of the situation that they're in. Ms. Danielle, I don't know if you want to add to that.
Yes, and I want to also add most diabetic patients, because he would have mentioned he's a diabetic, right?
Right.
Conversation started like that in the doctor. First of all, exercise can only contribute to 20% of your, no matter how much you exercise. All Sundays, no Sundays, 5 days, 20%, right? At best. 80% is going to be nutrition. Additionally, exactly. Most diabetics, they have issues with circulation. They have issues with, they may have to amputate a toe, a leg, something. So their ability to exercise may be decreased.
True.
We always, I, as a nutritionist, persons always say we are what we eat. We are what we eat. And it's a peeve of mine because it is not scientifically accurate. We are not what we eat. We are what we absorb.
Well said.
And yes. So type 2, notice I'm saying type 2 diabetes, listeners, not 1, which is sometimes, it's hereditary and you have an internal issue going on, but type 2 diabetes, all type 2 diabetes sufferers ate themselves into that. You eat yourself into type 2 diabetes.
Exactly.
Which means that you have to eat yourself out of it. Exercise yourself out.
True.
It.
Yeah.
You have to eat. So it is type 2 diabetes is developed. It is insulin resistance that is developed over time. Because of the nutritional, the culture. And Jason, I want to talk about that truly culture. Because every country, every region have a culture,
True, of course.
I spent an extensive time in Europe and they have a different food culture than us.
True.
They have the wine and the cigarettes, part of their food culture.
Yes.
Whereas we have the rice and the roti and the
macaroni pie, the potato salad. Yeah.
You name it, the rice, right?
Yeah.
And so our food culture is what have us with 1/3 of the nation having diabetes, and this is something that we need to understand.
Correct.
And exercise can help you regulate type 2 diabetes and perhaps may contribute to weight loss. The significant focus has to be on gastric absorption, nutritional and dietetic and digestion.
Yes.
And this is what this program is doing. You have a medical nutritionist working with a doctor to give your physician supervised weight loss. That's what it is.
Yeah.
It's a physician supervised weight loss program.
Correct.
that will be supervising and monitoring your levels, your blood sugar levels, your blood pressure, your blood cholesterol levels, your blood pressure, your CBC, your hormones. We'll be checking your bloods all the time, every step of the way.
Definitely. So there's a monitoring process. There's a process where, as I said, empirical data, you could manage what you measure and now make the necessary comparison, and you have the data there. Again, those telephone numbers, you can give us a call on 222-8261. That's 222-8261 for additional information. As well, we're having a live discussion. So to this, I don't know if you have any questions there as well, sir.
Yes, we do have a question a little off the topic there, but on the line. What's the best thing you have for a 22-year-old who is studying and is having memory problems?
Oh, okay. Well, basically, at Batson and Associates, again, we carry a wide range of products. There's a product we have called Cerebral, and the ingredient profile in that basically is one of the things that is used for children who have attention deficit hyperintensity disorder. And that particular challenge is one where you lack the inner, or you have the inability to focus for extended periods of time. You lose interest very quickly, and that particular product actually has the ability to help the body do that. It's a natural adaptogen. That's Cerebral. We also have a product called Nerve Restore. And keep in mind too as well, we are live on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad. And on TikTok, we are Batson and Associates. And this discussion that I'm having this afternoon with Ms. Danielle here, of course, is going to be on our social media. So subsequent to this, you could actually go and look at it. You could tag us, you could share us. Share it rather, and of course, additional information as we launch this weight loss, predominantly for the number of reasons that we have recommended, and also to the time of the year. A lot of persons, we're going into the new year, and I tell persons I don't believe in resolutions per se, but what I believe in, as they say, your goal is supposed to be SMART. They tell you, which is an acronym for specific, measurable, attainable, realistic, and targeted. And this program really covers that, because a lot of persons, you want to give yourself that gift of good health. This diabetic situation, Ms. Danielle mentioned amputations. I mean, I've seen so many persons have issues associated with the amputation, but not even the amputation alone. I tell persons, when you have diabetes, you're literally like a block of ice in the sun. And you all would have recognized the kind of heat that we had this year, July. This July was the hottest July they said in 1,000 years. But the thing is, with diabetes, you also have complications associated with your eyesight. When you're a diabetic and you have those issues with the imbalances that we're discussing here, your likelihood of developing glaucoma is significantly increased by about 85%. Your likelihood of having issues associated with diabetic neuropathy, poor circulation, issues associated with detached retina, which is bleeding behind the eyes. You find diabetics with those serious hormonal imbalance challenges have serious eye issues, where they always have to either undergo eye surgery or injections, which a lot of times is not necessarily as fruitful as they would like, because of the amount of oxidative stress and inflammatory response in the body. As Ms. Danielle mentioned, you are what you digest, or what you absorb in the body. And that is the important thing. It's not just a matter of just eating, but also how is your digestive system. We tell persons life and death lies in the gut. That is the gastrointestinal system is the most important organ system in your body. Your colon is the most important organ in your body. If that system is not functioning properly, your immune system is significantly compromised, and then you open yourself up to a number of things, cancer and that type of thing. And cancer, again, is something that is on the rise, and that is associated, as Ms. Danielle so rightly mentioned, with hormones, estrogen especially. Ms. Danielle?
Yeah, and then you mentioned there too about, and I want the blood mice.
Microscopist. Yes, Mr. Green. Yes, yeah.
Yes, to speak on bloods, because I depend very heavily on bloods for the weight loss program. We always send the patients for bloods. We look at the bloods, because I always tell persons the blood is the bus route or the highway of the body. Your blood passes through and washes every single organ. So your blood, if the blood passes through the heart, the lungs, the liver, the kidney, everything. If you look at the blood will always give you an accurate story of what is going on inside. It's one of the most, as a medical nutritionist, we are trained and we have to take samples from patients.
Yes.
So we usually take all your excreting samples, which is your saliva, you test saliva, urine, stool, even perspiration. All of that tells a story.
Yes.
But the most accurate is your blood, because your blood touched every organ. And when we pull there, we know what's going on. It's your transportation, right? But you didn't mention about the colon. That is why colon and pancreatic cancers.
It's so prevalent. But let me just allow Mr. Green to answer that aspect, so that the audience will, get that aspect of the blood, and we'll continue.
Yes.
All right. Actually, it is a very interesting question. And what that question allows you to then zone in on is the appreciation for what blood work can do. Now, Ms. Daniel, you did highlight the testing of blood. We know blood is one of the most tested steroid.
Yes.
And in that, you are able to assess your CBC, or you're able to assess the different aspects of a CBC. We know that we can look at things like your hemoglobin levels, your mean corpuscular hemoglobin levels, and how those things could really impact even something as weight loss. What we are able to then do with the help of Ms. Daniel is also to not only look at the regular testing methods, which is done in our lab, but we also have the opportunity to introduce what a blood analysis does. And you will now be given an opportunity to really zone in on the aspects of blood analysis that is not usually seen on that of the regular lab tests. And in blood analysis, you could see different instances of things like undigested lipids, which gives you an indication that this person is not digesting well.
Correct.
Which really goes back into the conversation that we're having. How digestion and poor digestion have a direct link to that of weight gain, or the inability to lose weight. So we are able to measure both methods of really assessing blood to really zone in on what it is we're going to go about, or how we're going to go about treating a given client based on their individual needs. That is another thing you're zoning on, Ms. Daniel. Really going back to what a person needs from an individual perspective. And I guess that's what made this particular program very different from the other weight loss program that is out there.
Indeed. You interestingly mentioned there about undigested lipids, and that is so important. I've seen bloods where you can actually see crystals forming in the blood. And once I hear that a patient is having issues with digesting lipids, I know that even if I change what they eat, because they have a problem with metabolizing fat.
Exactly. Yeah.
Right? That, for the listening audience, metabolizing means breaking down of. So if you cannot, because the four main macros you have in food: carbohydrates, protein, fats, which are lipids. And when we say lipids, that will mean fats, and alcohol, right? And so if your blood is showing that you cannot break down fats, that's any kind of fat, and I'm trying for you to lose fats, and I'm not taking that into consideration, and you just exercising, you see why?
You're spinning, as the old people say. You're spinning top and body. You're not going anywhere.
Correct. So even if you try these weight loss programs out there and you meal replace and you do all of that, many of these meal replacement shakes do have levels of fat in it.
Exactly.
Made from soy, which is our next drama, because soy is a
phytoestrogen.
Phytoestrogen, and the body treats it like an estrogen. It treats it like that hormone that supports weight gain. Remember, excessive estrogen contributes to women and men putting on weight, because they say, well, you're pregnant, you need to be fat. I just make it understand.
Yeah, definitely.
And so that is why an all-effective weight loss program, I'm a product of my product. I have been I am an endomorph. Those who know me personally could be found as the Curvy Nutritionist on Instagram, TikTok, etc. From Classy Bodies Wellness, and I know what it is like to be naturally curvy. I know what it is like to not have things work. And when you know your sister eating and she's skinny, and everything, you just smell food and it's weight, right? People shaped like that,
right.
and you have to take those body types into consideration.
Exactly.
Yes. So all those things, when you do a program, this particular physician supervised weight loss program with us, it's marrying integrative medicine with medical nutrition,
yes,
with persons who have been doing this for years. I have been a medical nutritionist for over a decade now, and I have helped thousands of local patients. I understand what it is like to be a Trinidadian battling obesity.
right.
I understand what it is like to, be aging. And there was one patient who cried. She was pre-diabetic.
Yeah.
And walking herself into diabetes at 32 years old.
Mm-hmm.
And only through our clinics was able to reverse that.
Yes, excellent.
I really love this conversation on topic, and I'm hoping that our listening audience is hearing the information put across differently that makes them start to think and come into these clinics, come into persons who are passionate about what we do.
Definitely.
But we're also responsible enough to not be painting a broad brush.
Of course.
Results that we are individually considering you.
Exactly.
We're looking at your bloods, your results, your scans to be able to help.
Even too as well too. Let me just quickly mention here before we take any more questions. ESRs, that aspect that looks at erythrocyte sedimentation ratio, which measures inflammatory response in the body. A lot of persons don't understand how inflammation affects disease, because once inflammation is present, it creates an environment that is conducive to just that sickness, hypertension, problem with post digestion, diabetes, those type of things. So even that as well, when taken into consideration, gives us, because if your ESR is over 100, your ESR is supposed to be 0 to 20. If it's more than 100, it is said that your likelihood of developing cancer is increased by 98%. Notice that 98%. So that's just to tell you how important those things are. So again, I will go over to third base, and if he has any questions, if not, at least remind the listening audience of the numbers so that they can call, and we go from there.
Yes, our numbers to call are 627-3223, 625-2257, and of course, WhatsApp numbers 306-1065. We do have a question on the WhatsApp. Good day, doctors. I understand that this thing called glutamate affects people's memory. We have a lot of foodstuffs and snacks that contain this product that makes children and even adults become hyperactive. Can you give any explanation?
Okay. The thing is that I don't know if in saying what the product is, they mixed up as reference to what glutamate is. That is a substance. I believe the one that you're referring to is one that is normally put in a lot of food and additives and that type of thing. That is not what we make in reference to here. This is something completely different. It's an enzyme that helps with improving digestion and the effectiveness of the digestive system. So let me just clarify that. I don't know if you wanted to add anything, Danielle.
They also confuse with glutathione.
I don't, because glutathione we know is the master antioxidant, and that in itself is glutathione. In order for vitamin C, for example, to even do what it needs to do in the body, glutathione has to exist. That's produced by the liver, right? So I don't think it's that. I think they were confusing it with the other thing. But of course, with that, yes, we have okay.
Good afternoon, Doctor.
Good afternoon.
Fasting is very important for the body. I mean, the body needs to at least fast on water for at least 3 to 4 days straight water only, but it's never recommended by the health information and the health rules and trying to build. Can you tell me why?
Okay, well, the thing is, that's not the case. I am a huge advocate of fasting, especially intermittent fasting. If you look at any of
Yes.
my podcasts or any of my programs, I speak extensively about that, and I am fully in agreement with that. I fast at least 1 day every week, sometimes 2 days, depending on it. And I would have hot tea, and we actually recommend in our protocol fasting because when you fast, the body actually goes onto the reserves and it takes certain things. So the body goes into scavenger mode and it actually interferes with things like gallstones and fibroids because the body is now, what you have essentially done is turn the body into having to go into scavenger mode and look for nutrition. And a lot of those things, for example, kidney stones. Kidney stones have nutrition in it, you know. You have calcium stones, you have magnesium stones, you have uric acid stones, you have combination stones. When people who have gallstones, what do you think gallstones are? Gallstones are undigested fat that could not have been metabolized by the gallbladder. Notice the word metabolize, digestion, absorption, assimilation is coming up consistently because, as Miss Danielle so eloquently put it earlier, there's a next way we say it. I remember one of my professors in university, one of the things she said is she used to quote this individual who said, "It is human to eat, but it is to digest, sorry, is divine." So to eat is human, but to digest is divine simply because a lot of persons do not assimilate their food properly. Look, for example, a lot of persons suffer from leaky gut. Leaky gut syndrome is one of the largest contributors to inflammatory bowel conditions, things like Crohn's, irritable bowel syndrome, diverticulitis, even people who have GERD, which is gastrointestinal reflux disease, which people call acid reflux. Now, the thing is, we have to understand very quickly that cancer doesn't start off as cancer. And I always tell people this. And that's why I tell persons I'm not in the politics of medicine. I'm about getting people who serious, who want to get better. If it is you think you don't have any self-control and you could eat the whole world, well then definitely, we could help in that area too, because the thing is, even with stress and high levels of cortisol, which is the stress hormone in the body, and inflammatory response, it even interferes with your ability to with self-control and to actually mentally have more discipline. It makes you weak. A lot of people don't understand that when you consume certain foods, especially high amounts of sugar, your resolve is just to eat more and more and more because that's what the body essentially wants because of sorry.
That quickly with that, Jason, see that
Yes.
mentioned there cravings. That's cravings that you're describing there.
Yep.
And inability and decreased ability for satiety.
Right.
Satiety or sensation is the ability to feel satisfied. And when what you're talking about there happens to a lot of persons,
Yes.
why they get them into obesity is because, and that's the program that we're trying to promote here on this program. It's literally that semaglutide is the GLP-1 agonist that
Right.
signals to the brain that you are full. And that is missing with a lot of
individuals.
Yeah. Do not secrete semaglutide at all.
Yep.
So they could go and go and go and eat and eat and eat. And then they start developing cravings for things. Usually people crave for two types of things. They have a sensation for sweet,
right,
or very, very salty. Savory.
Correct.
Which really is the body demonstrating these cravings is really deficiencies.
Correct.
So because
very much
you've eaten so much, you develop certain deficiencies and then you develop these cravings that you do not need.
Yes.
Because your stomach literally does not know when it's full.
Yeah.
Because your stomach is supposed to work in tandem with your brain.
Exactly.
So if it's not signaling your brain that I am all right,
yes,
this is enough for me.
Thank you very much.
Yeah. Going and going and going. That's why a lot of persons train themselves to overeat.
True. Well said.
Their brain really is like cannot tell when it is it is satisfied.
Definitely. But Shakila, let me just interrupt you here because you know when you're having a good time just fly, right? So it's now 1:58. So let me quickly, of course, just give those telephone numbers again. This program, of course, we're gonna have many more of these. This is basically the introduction program to this entire program that we're having here. Keep in mind that number at the Felicia Gona's office is 222-8261. That's 222-8261. For this program, again, you can actually get it on our social media. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad. And on TikTok, we are Batson and Associates. Let me thank very much Ms. Shakila Daniel and, of course, the listeners of Freedom 106.5 FM for having us. DJ, sir, always third base, rather. Always a pleasure to be in your company, sir. And as we always say at Batson and Associates, if you think health is expensive, try sickness.
If you think education is expensive,
try ignorance. Ms. Danielle, again, thank you so very much. And I look forward to more of our programs as we continue to promote this wonderful weight loss protocol that we have Batson and Associates and Classy Bodies has brought to Trinidad and Tobago and the world. Thanks so very much again. Take care, guys, and God bless.
All right, folks, if you listen to Batson and Associates and his guests there, right here on Freedom 106.5. Join, of course, the Holistic Health Program at 1:15 every Thursday, 1:15 to 2 p.m. right here on Freedom.
Your solution to talk is
great, guys. Great, guys. We handled that pretty well considering you know, we had some surprises in between there as regards to that whole arrangement because you know, this is something that Batson and Associates have been trying to get on board with for the longest while, and you know, Ms. Danielle has indeed presented a catalyst for us to do that. Thank you so very much. You know, of course, let me say a pleasant good afternoon to our social media, Miss Wendy Sample, Miss Sintra Ramada, Miss Kamala Samru. Always a pleasure to have you guys, Miss Elizabeth Mary, Shirley Dorset, Lucetta Jamet, Miss Elizabeth Mary, Carol Myers, Miss Kathleen Ishmael, my dear. You know, she says, this is the good life in the form of a program. Thank you so very much. She said nutricide, nutritional suicide. Miss Petronella Joy Felix, good afternoon to you. Miss Susan Gogran. Keep in mind, guys, oh, and I forgot to say that on the program. Tobago, you know, Batson Associates is back up and running in Tobago. Of course, more things coming for you guys. So keep in mind that we have our consultants over there. So those of you in Tobago who have been waiting, you need to get your blood analysis, you need to get your magnetic resonance analysis scan. Feel free to, of course, give us a call. That number for the Tobago office is 226-455. That's 226-45. So we're talking about the 20, 25, 30 pounds, you know, and have been having challenges for years. That stubborn belly fat, that visceral fat, as we discussed in there, that I think so many persons don't know about, Mr. Green. You know, I remember speaking to someone the other day, and I was like, wow, visceral fat? I thought all fat was fat. You know, that's not the case. Visceral fat is literally trying to kill you while you sleep. Okay, guys, so, Miss Susan, she says she is in Toronto. Okay. Yeah. So we bring an end to this program, and very soon we'll be joining DJ Mamu on djmamuradiott.com. That's djmamuradiott.com, and that program is going to be live for 1 hour. So we go from about 2:20 to about 3:20. And we'll be again discussing health. So any questions that you may have, because I saw we had some questions there that we could actually hear from Miss Jacqueline Tyson. And a pleasant good afternoon to Miss Karishma Ramdan. So guys, we'll see you in a bit. djmamuradiott.com. That's at 2:20. And we go live for 1 hour. Take care, guys. God bless.